Alabama Arise partnered with local hospitals to present a panel discussion on protecting healthcare in the local community. The event took place in Brewton, Alabama in February and featured a focus on how Medicaid expansion would help not only the people receiving care, but the hospitals that provide it.
I'm Marcia Rollerson. I'm a pediatrician. I've lived and worked in Brewton, Alabama since 1980. And I'm here tonight to talk about how important it is for our state to expand Medicaid to adults. Tonight we're meeting at D.W. McMillan Hospital in Brewton to talk about the future of our hospital and how that's tied to expanding Medicaid to adults in our state. We're going to go over the research that's been done to show that it really won't cost our state anything to expand Medicaid.
So there are reasons to debate. There are ways to improve Medicaid, no doubt. Our task was, can we afford it? And we found that, yes, we can if we choose to do so. And what we found, there's my slide, that expansion would add about 283,000 people to the rolls in the state. Different groups have slightly different numbers, but they're all within that same high number.
The other thing is, I live and work right close to a rural hospital, and I love my hospital. I think we have excellent staff here. We provide good care for people. But we're in the red for the first time since I've been here. And if something's not done for the uncompensated care that we provide, our hospital's not going to last. One of the things that I have read about is that the states that have expanded Medicaid in the South, like Arkansas and Louisiana, their rural hospitals are not closing. We've lost 13 hospitals in the last few years. Louisiana has lost none. Arkansas has lost only one. So it's extremely important for our hospital to get the expanded Medicaid funds to help us stay open.
Medicaid expansion is long overdue in our state, and it is vital to keeping our communities thriving with access to strong health care systems. For a small rural health system like what we have, the services that we offer is significant. Service lines offered today at D.W. McMillan include family medicine, OB/GYN, after-hours care, general surgery, labor and delivery, emergency, and inpatient services. Over the years, we have developed a wide range of outpatient services as well as visiting specialists from other places like Mobile and Pensacola that come right here. Those include cardiology, gastroenterology, nephrology, oncology, orthopedics, physical therapy, sleep medicine, and urology. And I'm sure I've left something off. Expanding Medicaid would provide significant relief to financial strain on our hospitals and ensure that we can continue to provide the access to this care here locally.
You had to drive to Pensacola or to Mobile for just casual primary care services. In some cases, I can't do that. It's a strain. If I'm, an elderly patient who may struggle driving at night and I can't get down there till later in the day, or if I have to take off work to drive my family member down there, that's a real strain. And what ultimately ends up happening is people don't access health care. And again, that leads to much worse outcomes.
Our rural hospital is the first line of care for the people in our community. If someone's really sick, they need to be stabilized. They can be stabilized here quickly and efficiently. If our hospital closed, it's a long ways to Mobile or Pensacola, and people will die.
So the moral to the story: no hospital, no emergency room in country. No hospital, no surgeon. Surgeons don't work in cities where there's no hospital to do their procedures. No hospital, no lab. No hospital, no blood bank. It was able to come up with the 8 units of blood that it took before I got out of the hospital. No anesthesia to put you to sleep when they put that big black snake down your throat. I think some of you have had it. No hospital, no ICU to look after you when you do have an emergency room. So the moral to the story is do what it takes to keep the hospital in this town and in this county